Patrice Birch Forbes, Grand Canyon University, Leadership in Healthcare Systems Practicum, August 11, 2025, NUR 674. Nurse Resiliency and Burnout Prevention. Introduction. The Nurse Resiliency and Burnout Prevention Initiative is a strategic response to the growing emotional and physical toll on nurses in high-stress healthcare environments. This initiative promotes mindfulness, ethical competence, and resilience through organizational guidelines, fostering a culture of support, empowerment, and work-life balance. This aligns with business skills and principles, human resource management, ensuring a safe and healthy work environment, promoting self-care and empowerment put forth by the AONL, Nurse Leader Core Competencies of the American Organization for Nursing Leadership, AONL 2022. Site, organization. This practicum site is a non-traditional commercial insurance setting where registered nurse case managers work alongside physicians, pharmacists, social workers, and data analysts to create multidisciplinary care plans that prioritize prevention, affordability, and access. This model encourages the strategic use of resources to reduce unnecessary interventions. Regular interdisciplinary collaborations foster alignment of clinical goals, evidence-based practice, and the responsible stewardship of resources. Nurse case managers contribute to the strategic planning by leveraging clinical insight as a guide to cost-effective and quality care. Assessment. Assessing nurse resiliency and burnout is essential for promoting workforce well-being, sustaining engagement, and promoting high-quality care. A needs assessment was conducted via strategic interviews with both frontline staff and leadership to assess potential problems. The Maslach Burnout Inventory MBI survey was used to assess emotional exhaustion, depersonalization, and personal accomplishments. Prior to the start of the initiative, data collection surveys were administered anonymously to ensure honest feedback. The initiative comprised of 12 weeks of strategically targeted interventions. Post-intervention assessments were also completed by administering the same survey to the same group to assess for changes. Nurse resiliency interventions. Nurse resiliency programs are structured initiatives designed to help nurses cope with emotional, physical, and the psychological demands of their profession. These programs are recognized as essential for maintaining high standards of care, fostering nursing engagement, and creating a safe and healthy work environment. Goals. Identify and promote factors that may reduce nurse burnout and compassion fatigue. Promote work-life balance strategies. Ensure access to mental health resources. Outcomes, benefits. Engage professionals who deliver consistent patient-centered care. Empowered nurse case managers who respond effectively to complex and high-pressure situations. Empathic care coordinators committed to high-quality patient-centered outcomes. Higher job satisfaction and staff retention, an organizational culture of psychological safety and open communication. Stakeholders. This model exemplifies how nurse case managers collaborate with a multidisciplinary care team to promote access. In a non-traditional insurance setting, nurse case managers drive transformation by integrating ethics, equity, and economics into everyday practices to ensure quality outcomes. Engaged and productive nurses are an essential component for identifying effective, evidence-based, and high-quality care options. Sustainability. Sustainability depends heavily on the ability to implement two key components of resilience: decompression, the ability to mentally and emotionally recover from work-related stress; activation, the capacity to stay engaged, motivated, and purposeful despite challenges. Professional goals. Enhance clinical performance. Resilient nurses are more focused, adaptable, and capable of delivering high-quality care under pressure. Reduce burnout and turnover rates. Resiliency programs aim to lower emotional exhaustion and improve staff retention. Promote evidence-based practice. Resilient nurses are more likely to engage in continuous learning and to apply research to improve the quality of care delivered. Strengthen leadership capacity. Resiliency programs include strategies that build confidence, improve communication and decision-making skills, foster team collaboration. Resiliency programs improve emotional regulation and empathy. This promotes teamwork and responsible conflict resolution. Lessons. Effective resiliency programs improve emotional well-being, supports a healthy work-life balance, builds self-efficacy, encourages reflective practice, and cultivates a personal sense of joy and purpose. Conclusion. Finally, this initiative underscored the profound impact that nurse burnout and compassion fatigue can have on the nurse's well-being, professional performance, engagement, and the quality of care delivered. Nurse burnout is a multifaceted occurrence, often with a distinct origin, but multiple shared and overlapping consequences, including emotional exhaustion, reduced empathy, increased time away from work, and decreased engagement. Nurse burnout prevention initiatives are most successful with the introduction of resiliency building programs, organizational support for mental health, and leadership engagement that promotes workforce wellness and work-life balance. Thank you.